Why can't a hospital be more like a hotel? If you have been a patient in a New York hospital or spent time in a New York emergency room, you know that the absence of a positive hotel employee attitude, hotel amenities, hotel spaces, and hotel cleanliness produces a heightened level of anxiety that leads to ongoing fears. It is paradoxical that the WORD hospital is within the WORK hospitality, as both are derived from the Latin root meaning friendly reception to a guest or stranger. Hospital administrators do not see their facility as a place of comfort, but rather a place of disease and sickness. Hospital managers want patients that accept just being in a hospital means you will be uncomfortable. Perhaps this OCCURS, at least in some New York hospitals, because hospital administrators do not see their facility as a place of comfort, but rather a place of disease and sickness. Healing and wellness can be done at home, at the spa, or the Four Seasons. Ask any hospital manager to explain his or her working environment, and the response is likely to be that they need vitals, data, better alarms, patients that understand that all pain cannot be stopped, and acceptance that just being in a hospital means you will be uncomfortable and the future will be unpredictable. Ask the same question from a hotel executive, and the response is likely to state to be the most hospitable company in the world by creating heartfelt experiences for guests, meaningful opportunities for team members, high value for owners, and a positive impact in our communities, notes Matic.com. It is paradoxical that the WORD hospital is within the WORK hospitality, as both are derived from the Latin root meaning friendly reception to a guest or stranger. It is obvious that both hotels and hospitals have common core characteristics. 1. Serve demanding and increasingly well-informed clients. 2. Employ a large hierarchy of workers with varying levels of responsibility. 3. Payments are increasingly tied to guest-patient evaluations. While hotels are cognizant of their relationship to the public and heed markets research that has led to improvements in innovation with the objective of improving customer satisfaction, hospitals have ignored the reality that their primary function is to turn a sick patient into a well person and not to increase bottom-line profitability. Because of their misguided mission, there has been little, if any, cross-fertilization between the hotel and hospital industries. Patient satisfaction studies. Changes in the healthcare system are forcing hospitals to become more concerned with patient approval, and patient satisfaction is being monitored by Hospital Consumer Assessment of Healthcare Providers and Systems 2010, COPSA, and Press Ganey surveys. And COPSA survey is the first national, standardized, and publicly reported survey of patients' perspectives of hospital care. It questions issues that include communication with nurses and doctors, responsiveness of hospital staff, cleanliness and quietness of the hospital, pain management, communication about medicines, and discharge planning. This research has become one of the measures used to calculate value-based incentive payments in the hospital value-based purchasing program. Beyond reimbursement, patient satisfaction may also be a marker of clinical quality. Press Ganey surveys strengthen patient-provider relationships with comprehensive surveys and rounding approaches that enable real-time feedback and performance benchmarks. The hotel industry has always been cognizant of guest satisfaction as a goal. At an absolute minimum, the guest should be satisfied. However, exceeding their expectations is the goal. The industry has devoted decades of effort and resources toward improving products and management structures in order to remain competitive. Hospitals could leverage these lessons by adopting and adapting hotel practices that can lead to significant improvements in patient approval and satisfaction, ultimately benefiting hospital management staff, physicians, employees, patients, and bottom-line profitability. Similarities and differences. Hospitals and hotels focus on guests' patients who obtain lodging and services. Just as there is a wide variation in hotel accommodation from Holiday Inn Express to Four Seasons hotels, there is a huge range in the size of hospitals as well as ambience and quality. Both employ a large hierarchy of workers with varying levels of responsibility. Hospitals and hotels create an experience for their customers' patients with associated emotions. Differences. Hotels are paid directly out of pocket by customers, while hospitals are usually paid through intermediary insurance companies. In a hospital, customers are patients, typically anxious and apprehensive about their impending treatment. Patients may have a choice as to which facility they seek care. However, on many occasions there is no choice as most patients have a medical emergency and they must be at a hospital. At a hotel, customers are guests, typically excited, if for leisure, about their visit. In most cases, guests choose their hotel and the timing of their stay. From the very beginning, hospitals are at a disadvantage, therefore, they should do more than a hotel to ensure patients' comfort. The foremost priority of hospitals is, and always should be, to improve patient health, but patient comfort and well-being should not be neglected along the way. Doctors face many challenges in providing their patients with the highest level of satisfaction, although many physicians never see their patients when they are in the ER or in a bed at a hospital, at least in the 2 New York hospitals I experienced, thereby escalating an already unpleasant experience into one with increased anxiety. Roles and responsibilities. The array of healthcare professionals can be daunting to patients, i.e., residents, physician assistants, nurse practitioners, and others with varying degrees of experience who pop in and out of the patient's space, never quite explaining who they are, their jobs, responsibilities, or their role in improving the quality of the patient experience, and rarely returning with feedback or any new information. In a hotel, workers have clearly defined roles: front desk, concierge, room attendant, waiter. In a hospital, however, the various members of the medical team may be foreign to a patient. Some hospitals have implemented face cards, card with photos, training, and interests are handed to each patient, and they have improved patient knowledge of the names and roles their hospital physicians and team members with whom they interact. Patient systems and procedures. Pre-admission. Before admission, patients undergo laboratory tests, receive questionnaires about their current medical state, all contributing to mounting apprehension and discomfort. To minimize this anxiety, it would be helpful if hospitals provided patients with information so they know what to expect. Check-in process. Hotel employees know that the first 15-minute guest experience is critical as they set the tone of the visit. They know the expected arrival time of the guest, have reviewed the guest's profile and photograph, and when the guest arrives, they are able to greet the persons with a "warm, we've been expecting you." In stark contrast, hospitals are likely to know less about a new arrival unless they have been patients with the hospital in the past and the information is in the database. Regardless of previous association, the hospital requires the customer to sign in multiple times at multiple stations, frequently wait hours in the admissions area, and typically receive patients with name, photo ID, insurance cards, please. With the amount of information hospitals have about their patients and their waiting times, room availability, and physician availability, much could be done to improve this check-in process. Redundant information gathering could be minimized, existing patient photographs could be utilized to recognize the patient, and waiting time could be reduced.